Bilhazia is caused by a worm called schistosoma. I know that is a very complicated name. This worm can cause major problems. How do we get this worm into our bodies? How does this worm bring problems in our bodies? I will begin by showing you how this happens. What happens is a person who is infected with Bilhazia, who goes to the toilet, either to susu or to poo in a river or in a place with stagnant water, they pass the eggs of the Bilhazia into the water. These eggs will hatch in the water and they will develop into this bigger form here, which penetrate the snails in the river. The small little snails in the river that carry the Bilhazia worm. This then develop into a larvae. The larvae, which is this form here, will then penetrate the body of another human being who has gone into the water, either to walk, to farm, or to do other things. When they penetrate the body of the person, you may get a little rash or a bit of itchiness. They penetrate the body, they go into the bloodstream and are carried to the lungs, to the liver, to the intestines, and to the bladder. When they are carried here, they then develop from this form into an adult worm. This is a mature adult worm which is about 2 centimeters long. That is a very long worm to have in your body. These worms will lay up to 1,000 eggs a day in your intestine and in your bladder. These eggs cause a lot of irritation in the bladder and in the intestine, and even in the lungs and in the liver. You will then develop symptoms such as cough, such as feeling tired and feeling very sick, and some stomach pain. But then how will you know that you have Bilhazia? This irritation will cause you to have bloody urine and bloody stool. So you will have blood being passed in the stool and blood being passed in the urine. This usually happens 2 to 3 weeks after the worm has penetrated into your body. Then the cycle begins. If you then go to the river or to a place with stagnant water and don't do susu or do poo there, you will pass these eggs into the water and someone else will get infected. Now that is the life cycle of Bilhazia. We do not want this to happen. So how do we make sure that this doesn't happen? If you have bloody urine and bloody stool, if you have stomach pain and cough, please go to the nearest health facility and get tested for Bilhazia and get treatment for this disease. Do not stop the treatment before you have finished the complete dose, because you must finish it all for you to be totally cured. How else can we manage to prevent Bilhazia? We know prevention is better than cure. So first things first, do not go and do poo or do susu in an open place. Use the latrine. And make sure that you do not do it in a place where people are going to actually go and enter the water. 2, always wear gum boots or protective boots if you're going into a place with stagnant or slow moving water. Preferably avoid these places if you can. Do not play in stagnant water, children. This will help you prevent getting Bilhazia. The other thing is to make sure that when a latrine is being dug, it is not dug in a place where there is next to the river or next to a water source where these eggs can pass and go into the drinking water or into the water where people are actually going to go and walk in. So children, please make sure that you avoid getting Bilhazia by using these simple steps to make sure that we prevent this disease from spreading. Remember, prevention is better than cure.